All right, so we'll be doing an IV piggyback. So I will start by preparing my medication according to the 6 rights. So right patient, right medication, right dose, right route, right time, and right documentation. So I'll go to my MAR, double check the physician's orders, make sure I have the right medication, that the medication is right according to the patient's weight. So we're gonna be adding chlorine today. So for my patient, I need 1.1 milliliters of chlorine, which will be added to a secondary IV bag. So I will start by getting my syringe here. If I can get the thing to separate, of course. Okay, and I perform hand hygiene before I do this as well. So I'll take an alcohol prep. I'll also check the medication for the expiration date, make sure there's no particles, anything like that, any discoloration. I'll also check the vial if it's been used before for the previous nurse's initials and when they opened it. So then I'll start by drawing 1.1 milliliters of air here. Okay. Inject the air and draw up the correct amount of medication. Okay. And then I'll recap my needle using the one-hand technique. Okay. There we go. So I can return that, and then I will take all this stuff into my patient's room along with a label for a medication added label for the IV piggyback bag. So when I go into my patient's room, I'll identify them using 2 patient identifiers. So name, date of birth. I'll also double check the IV line, make sure there's no injection site reactions, the line's still patent, all that kind of stuff. So we'll get this opened here. Oh my goodness, there we go. Okay. And then we will take our alcohol prep pads here, and we'll clean the port. Okay. And then we'll uncap our needle in the port and inject all of that medication, and then dispose of this stuff in the sharps container. All right, and then we will get our secondary tubing ready here. Okay. All right. We'll be sure to close the roller clamp. Okay. Then we'll take that off, this off. Okay. Then we'll fill the drip chamber here. Okay, so about halfway to that line there. So for an IV piggyback, you're going to want to hang the secondary bag above the primary bag. So you'll want to take this bag down, this, and then you'll add it like this to your IV pole here. Okay. And then you'll take and clean off that and uncap piggyback and hook that. All right. And then you'll want to be sure and establish the correct drip rate. And so per the physician's orders, and before I hooked my piggyback up, I primed my secondary IV tubing, and So then after you attach your piggyback, you establish the drip rate, and as soon as that that secondary medication was all done, you would want to detach your piggyback and then rehang your primary bag back to the normal height and double check that drip rate, make sure everything's still going good with that one per the physician's orders, and then you'd want to document everything you did, and you would have added this to your piggyback bag so that anyone that comes behind you knows that there's medication added to that bag and what the medication is, start time, drip, like the rate, who added it, so all that stuff.